Sean Spicer was just peppered with questions about the viability of the GOP health plan during the White House press briefing. He just said the plan is going to be in discussions to be amended in the House before it gets to the Senate. He's also saying, you know, look, absolutely, it gives more choice to everyone on insurance plans, but the breaking news is that there may be a tiny crack in the ice there with the House before it even gets to the senators. But we also have this breaking news. Republicans and Democrats on the Senate side might be coming together on the plan. New York Senator Chuck Schumer just spoke with reporters and said he wants a public option in the health care plan to encourage more competition in the market. This, as Senate Majority Leader Mitch McConnell said, the House GOP plan is open to amendment once it gets to the Senate. Okay, let's decipher all of this. Let's bring in former Democratic Congressman from Ohio, Dennis Kucinich, and former Republican Congressman from Michigan, Pete Hoekstra, on whether, gentlemen, a tiny ray of light might be coming through that crack of ice. Congressman Hoekstra, decipher the code between the two senators. Could we start to see some positive negotiation?
I really think you can. I mean, I was reading and following it this morning. They're saying there's a quote-unquote, in technical terms, a major manager's amendment that will be made when the bill comes to the House floor, probably next week. So what is that? That are negotiations that Republican House members have agreed on that they will put into the bill before they ever send it to the Senate. And I always did expect that somewhere along the line, Democrats and Republicans would come together to move this bill forward. That's good for the American people. And, you know, what it signals is we're going to have a long-term fix for health care, not something that changes every time we change administrations.
Congressman Kucinich, what provision would you demand to see as a Democrat if you were still in the House within this plan? As you see, we have Senator Schumer saying at least put in, you know, a government choice, you know, that single option there as part of the panoply of what could be offered.
Well, to have a public option is something that should have happened under President Obama, but he didn't want that, and the insurance companies didn't want it. Let's get real about what's happening here. This is a plan that it's a new for-profit plan. The Obama plan was an old for-profit plan. The new for-profit plan will mean that less people will be covered, the premiums will be higher. People 50 to 64 will see could see their costs go up 5 times as compared to younger insurance policy holders. The insurance companies are making out like bandits. They're going to have their fees reduced by $145 billion. Their stocks are going up because they're now, if anybody doesn't have insurance under this new plan, you don't have insurance, you pay a penalty to the insurance companies.
And the hospital stocks, by the way, that we're showing are definitely going down. And while health insurance stocks may be down today, we have shown them since the election. We've shown them since Obamacare, and they're up anywhere from 400% to 500%. But let me just push back a little bit on that, Congressman, because, look, there are phases to this. And within phase 2 and phase 3, that's when, at least the Republicans say, we would start to see the ability to buy insurance across state lines. Look, when you have a 529 plan, I live in New Jersey. If I like Idaho's plan because it's better, I'm allowed to choose that. With insurance, you haven't been allowed to do that. Won't that open more competition and bring the price down?
Insurance companies make money not providing health care, no matter where they're located.
Well, Congressman Hoekstra, I'm laughing because, listen, I'm not a fan of insurance companies. I think they use us all as ATMs, and they benefit. And by the way, yes, premiums rose under Obamacare, but boy, were they rising before Obamacare. So what do we need to see in this plan, Congressman Hoekstra? Because the Medicaid portion is causing some consternation. 30 states, including both Michigan, your state, and Ohio, right, Kucinich's state, opted to expand Medicaid for their poorer citizens. This plan scales it back.
Well, I think you're going to have a problem. Once you give an individual a government benefit, it's hard to take it away from them. But, you know, the bottom line here is what the Republican plan is going to do, and I hope some Democrats come on board, and maybe putting in a partial public option may be the way to do it to increase competition. But what competition is going to give us, it's going to give us, and it's going to give consumers choices. It's going to improve our delivery system. It's going to bring efficiencies into the marketplace. The choice is, do you want something that consumers are making a choice for quality and efficiency, or do you want the government making the decisions?
But you let them have that choice, and I'm all about the free market and choice. You've got younger people who think they're invincible. They will not pay for coverage. There will be no penalty for coverage because this one gets rid of all the penalties, which a lot of people say is a good thing. But they'll still get sick. Some of them will still get sick and show up on hospital doorsteps at their most expensive and worst point. Congressman Kucinich, do you see anything that needs to be in this bill to avoid that?
Frankly, in my view, as the person who helped write H.R. 676, Medicare for All, free market ideological principles are incompatible with a sustainable health care system which would take care of all the American people. Sorry.
Congressman Hoekstra?
No, I think you raise a very credible point. For those who do not have coverage, if you start creating the plans, younger people are going to most likely pick lower cost, lower benefit plans.
Or none at all.
Or potentially none at all. And at the hospitals, they are going to have the coverage that's demanded. Somewhere you're going to have to put in place a subsidy to recognize that that does happen.
Well, you and I are all going to pay for those sick people who are uninsured.
We will pay for it, yes. Yes.
Yeah, I don't like that.
No, I don't either.
So maybe in phases 2 and 3.
And they pay for us if we're sick.
Yeah. Well, listen, and maybe in phases 2 and 3 they can figure this out. But at this hour, the breaking news is that there may be this tiny bit of wiggle room as Senator McConnell and Senator Schumer are saying, well, maybe we can work on this. So we shall see. Right. Great to see you both. Thank you so much.
Great. Thank you.
Thank you.
Former Congressman Dennis Kucinich and Pete Hoekstra.